Health benefits of exercise for older adults. It's never too late to start an exercise routine and enjoy becoming the fittest and healthiest you've ever been, not even if you're in your 50s, 60s, or beyond. Everyone, regardless of age, can and will benefit from exercise, says Dr. Alyssa Kuhn, Doctor of Physical Therapy. Exercise is tied to so many health benefits, not only for your body but also your mind as well, she says. Exercise is tied to so many health benefits, not only for your body but also your mind as well. Physical health benefits of exercise for older adults. Whether you've never exercised before or you're rekindling an old habit, here are 9 big benefits of exercise for seniors to keep you motivated for the long haul. Bone health, preventing osteoporosis. Osteoporosis is a top health concern for older adults, especially for women, who are more susceptible to bone loss later in life. As you get older, your bones begin to deteriorate faster than your body can create new bone tissue. This results in porous bones, which are weaker and vulnerable to fractures. Weight-bearing exercise and resistance training are the top ways to combat osteoporosis. Weight-bearing exercise is any type of exercise that involves working against gravity. Examples include walking, hiking, climbing stairs, and dancing. Resistance training includes body weight strength training as well as weight training with equipment such as dumbbells. Muscle health, preventing sarcopenia. In addition to strengthening your bones, exercise, especially resistance training, also strengthens your muscles and helps you build more muscle tissue. Like osteoporosis, sarcopenia is a degenerative condition that affects older adults, except sarcopenia is the loss of muscle, not bone. After middle age, adults tend to lose about 3% of muscle mass each year on average. Exercise is the single most effective way to battle and reverse age-related muscle loss. Strength training is essential when it comes to muscle loss, as resistance training directly impacts factors that affect muscle growth. Specifically, lifting weights promotes the production of growth hormones and muscle protein synthesis, the process by which your body uses protein to make new muscle tissue. Cardiovascular health, blood pressure, cholesterol, and more. Beyond bones and muscles, exercise also improves cardiovascular health and reduces your risk of heart disease. Blood pressure. Exercise has positive effects on blood pressure because it makes your heart stronger. A stronger heart can pump more blood with less effort, thus decreasing the amount of pressure on your blood vessels. Most of the research on exercise and blood pressure looks at aerobic exercise, like walking and swimming. But some research also suggests that resistance training can lower blood pressure in the elderly, too. A program with combined cardio and strength training might be best at lowering blood pressure, according to some research. Cholesterol. High cholesterol is a risk factor for heart disease, and managing your cholesterol is one way to maintain your health as you get older. There's a linear relationship between the two, meaning that, up to a certain point, the more volume you do, the more your cholesterol levels improve. Heart disease. All types of exercise reduce your risk of heart disease. This is a something is better than nothing scenario, including heart attack, stroke, peripheral artery disease, coronary artery disease, atherosclerosis, cardiomyopathy, and more. Both strength training and cardio exercise have benefits, but again, science suggests that a combined program with both types of training has the best outcomes on heart disease risk factors. Maintain independence, strength, balance, and coordination. An often overlooked benefit of exercise is its ability to simply allow people to take care of themselves. Seniors often lose their independence when day-to-day obligations become too difficult. Physical activity helps you maintain your independence longer. Balance and coordination. The risk of falling and injuring yourself increases as you get older. This is due to many factors, but largely a loss of muscle mass, causing weakness, and a loss of balance and coordination. Keeping your muscles strong reduces your risk of falling, and performing specific exercises to help with balance will improve your ability to take care of yourself in old age. Activities of daily living. Thanks to all of the above, stronger bones, bigger muscles, a healthier heart, and better balance, regular exercise is vital to maintaining your independence. Many seniors require full-time care because they can no longer perform activities of daily living on their own. Activities of daily living include basic day-to-day tasks, such as going to the bathroom, getting dressed, taking a shower, preparing food, cleaning, and generally moving about your home and community. Physical activity, or lack thereof, is directly related to seniors' ability to perform activities of daily living. Mental health benefits of exercise for older adults. The benefits don't stop with physical improvements. Strength training, and exercise in general, is shown to have robust effects on the mental and emotional health of older adults. Decreases risk of depression. Seniors have an increased risk of developing depression, according to the Centers for Disease Control and Prevention, CDC. And like the CDC says, depression in older adults may be common, but it's not normal. The risk of depression increases as you age largely because the risk of other chronic illnesses increases with age, and depression is more common in people who have other health conditions. Physical activity is one of the best lifestyle-related antidotes to depression in people of all ages. More research is needed to understand how exercise might be prescribed as a defense against depression, but there's no shortage of evidence that regular physical activity can elevate mood in the short term and also help regulate your mood over time. Helps you find a community. An unfortunate fact of life is that with age, often comes loneliness. Seniors are vulnerable to loss of family, friends, partners, and pets, and it can be a serious detriment to their mental health. Fitness is a good way for seniors to discover a new community and find like-minded individuals to spend time with. Whether you join an in-person gym or invest in a community-driven platform like The Mirror, you're sure to build new connections when you pick up a fitness habit. Improves memory. Memory loss is a major concern for the older population. Luckily, there are a number of ways to combat memory loss as you age and, you guessed it, exercise is one. Physical activity has been linked to improved memory, of both the spatial and verbal varieties. Spatial memory is your ability to remember things like where you left your car keys or how to get to your mom's house without needing directions. Verbal memory is your ability to remember what you read and hear. Exercise is also shown to improve working memory, which refers to the way your brain stores, analyzes, and changes information during cognitive tasks. An example of working memory is doing a math problem and seeing the numbers in your head, or in a common case here at Garage Gym Reviews, using instructions to assemble a piece of fitness equipment and then using that memory to assemble a similar piece of equipment without instructions. Increases cognitive function. Not to get overly excited, but recent research showed that a single bout, specifically a 20-minute session on a stationary bike, can boost cognitive function in older adults. Obviously, there are a lot of caveats here, like the fact that the boost is temporary and the classic more research is needed .. But still, how cool. This finding suggests that the mental health benefits of exercise appear much more quickly than previously thought. On top of that, exercise is shown to reduce the risk of various types of cognitive decline, including dementia, later in life. Improves quality of life. All exercise improves quality of life through a marriage of all of the above benefits. Between stronger bones and muscles, a healthier cardiovascular system, better coordination and balance, better memory, and a healthy social life all put the golden in your golden years.